Hello, my name is Yaren. Today I will be talking about the adverse reactions related to the use of iodinated contrast media. So, what is contrast media? Contrast media are chemical substances that are used in radiological imaging to highlight the differences between various parts of the body where the examined organs do not have natural inherent contrast with the surrounding tissue. For example, if a structure of an organ were to have inherent contrast, the softer tissues would appear to be more darker and the more dense tissues would appear to be brighter. But if this is not present, then the contrast media improves the quality of images and therefore provides a more accurate diagnosis. Here we can see a CT scan. On the left, contrast media is not used, and on the right there is the usage of contrast media providing a higher quality image. Here we can see some commonly used iodinated contrast media. They can be ionic or non-ionic. Iodinated contrast media are usually safe, but like with all medical procedures, adverse effects and life-threatening reactions can occur. Knowledge of these side effects is critical for providing optimal healthcare. So, if iodinated contrast media can cause life-threatening reactions, then the question is, why do we use iodinated contrast media? Because it drastically improves the quality of radiological imaging. Although adverse reactions are rare, some common factors do predispose patients to these adverse reactions. For example, infants and patients older than 60 years old are more predisposed to adverse reactions. Adverse reactions are more commonly seen in females rather than males. Some underlying medical conditions, hematologic conditions, medications used by patients, and contrast-related properties also predispose patients to these contrast reactions. Especially, it's important to note that if a person has allergic reactions, they are more predisposed to these adverse reactions. There are two basic types of contrast reactions: A, anaphylactoid reactions, and B, non-anaphylactoid reactions. Anaphylactoid reactions are the most frequent Anaphylactoid reactions are the most frequent type of adverse reaction. Anaphylactoid reactions are the most frequent type of adverse reactions. Anaphylactoid reactions usually begin within 20 minutes of injection, and they are independent of the administered dose. Symptoms can be classified as mild, moderate, or severe. Mild symptoms include skin rashes, itching, nasal discharge, nausea, and vomiting. Moderate symptoms are the persistence of the mild symptoms, facial or laryngeal edema, bronchospasm, dyspnea, tachycardia, or bradycardia. Severe symptoms are life-threatening arrhythmias, hypotension, overt bronchospasm, laryngeal edema, pulmonary edema, seizure, syncope, and death. And Anaphylactoid reactions are unpredictable and anyone can have one, so even if you already had an ICM and no adverse reactions were seen, this doesn't mean that later administrations of ICM will not lead to any adverse reactions. They are unpredictable. Anaphylactoid reactions are the most frequent type of adverse reaction. Non-anaphylactoid reactions are believed to result from the ability of the contrast media to shift the body away from homeostasis, especially shifting the blood circulation away from homeostasis. These types of reactions depend on the physical properties of the contrast medium, such as its ionicity and its osmolality. Increasing iodine concentration, larger volumes of ICM, and the route of administration being intra-arterial, these factors increase the risk of a reaction to happen. Non-anaphylactoid reaction symptoms include warmth, metallic taste, nausea, vomiting, bradycardia, hypotension, vasovagal reactions, neuropathy, and delayed reactions. Extravasation is also an adverse effect that can occur with ICM. It can occur during hand or pelvic injection in 0.1 to 0.9% of cases, although it is more commonly seen in the elderly, infants, children, patients with altered consciousness, patients with an underlying vascular disease. The symptoms include a persistent burning and swelling at the injection site. Small extravasations of the contrast media result in the production of a local inflammatory response in the skin. Larger volumes of extravasation can produce tissue damage. Although it is a rare complication, aeroembolism can also result due to ICM, and it could be potentially fatal. The symptoms include dyspnea, cough, chest pain, pulmonary edema, hypotension, and neurologic deficit. ICM can cause kidney-related side effects. People with normally functioning kidneys are generally safe, but if the patient has already a severely reduced kidney function before iodinated contrast media injection, then if the injected ICM is in large amounts, this can increase the risk of temporarily worsening the kidney function. Occasionally, the kidney function reduction that occurs after ICM can be prolonged or even permanent. Small volumes of ICM does not affect the kidney function, and again, there is little or no effect on kidney function if ICM is given to drink or through a tube. In approximately 2% of the patients, 1 hour and 7 days after the injection, delayed reactions may occur. They are more commonly seen in patients with interleukin-2 chemotherapy and those who were injected with non-ionic dimers. Common delayed reactions are flu-like symptoms such as fever, chills, rashes, and nausea. And less frequent reactions include skin rashes. Delayed reactions also usually resolve spontaneously and are treated with supportive therapy. In the case for using ICM in pregnant and nursing patients, not much study have been done yet, so the safety of intravenous ICM during pregnancy has not been established. This is because there is a risk of the contrast media to cross the placenta, enter fetal circulation, and can cause thyroid disorders. Therefore, it is suggested that the thyroid function of the newborn to be tested in the first week of life if the mother had to have ICM while pregnant. ICM should be used in pregnancy only if the possible benefits outweigh the risks, because the safety has not been established yet. Here we can see some common contrast reactions. Like I said, there are two basic types, anaphylactoid and non-anaphylactoid. These reactions include skin rashes, bronchospasm, facial or laryngeal edema, hypotension and tachycardia, which is a fast pulse, and hypotension and bradycardia, a slow pulse. Cardiac arrhythmia, hypertension, seizures, and pulmonary edema. In conclusion, although iodinated contrast media may have some adverse effects, these adverse effects are generally not life-threatening. They are usually mild. And in contrast to this, they improve the quality of radiological imaging greatly. So generally, the benefits outweigh the possible risks, and therefore iodinated contrast media is occasionally used in these cases.